In a country burdened with disease, thousands of South Africans are diagnosed with life-threatening illness every year. Most of them will experience severe pain and won't have access to cheap and effective pain medication. For those who die, many will do so without the basic human right of dying with dignity and without suffering. Palliative care is an approach to medicine that aims to change this. It goes against our very nature for a parent to have to deal with the death of their own child. 2 years ago, Clement's parents believed they were going to have to face this unimaginable ordeal. Born with cerebral palsy and epilepsy, his condition is completely debilitating. He's unable to feed or care for himself and has difficulty breathing and swallowing.
Clement wazalwa ehlala ngokugula. Lokho azalwa ehlala ngokugula. Ehlala ngokuya kodokotela njalo kodokotela kodwa engasini ihlala eneyinhlungu.
Born to poor parents living in a rural township on the outskirts of Verulam in KwaZulu-Natal, receiving the medical care that Clement needs has been a constant uphill battle. When his condition deteriorated, they were told to prepare for the worst.
Hayi ngangikhala ngase ngizacinga ingaka me comes stink ngoba manje kwathiwa nje segula kakhulu funeka ngisayine sekuphelile ngaye hayi bangiduduza odokotela hayi bangiduduza no sister basethi ngaphatheka abhlungu uzoba ngcono umntwana is die wesenhlungu yini esefile sikwena.
Dr. Julia Ambler, one of a handful of pediatric palliative care doctors in the country, was called in.
We were asked to see Clement because he was literally at the end. The doctors who had been treating him for 4 months in hospital didn't know what to do. So his condition was very, very poor. He was grossly underweight. He was having seizures, infections, permanently on the oxygen. They just couldn't get him off. So he was in a pretty dire state. And when we met the parents, that's what we spoke about. We said, look, we don't know where we're going. I think the end is coming.
Last year, 15,000 South Africans were diagnosed with drug-resistant TB. Difficult to treat, it can leave patients unable to care for themselves for months. These palliative care nurses not only administer TB medication, but also bath and feed their patients. Palliative care is an approach to medicine which aims to improve the quality of life for a patient by doing whatever one can to make them more comfortable and relieve their suffering. It's most often associated with hospice and patients who are on their deathbed.